countries need to massively invest in nursing education. We need to grow our nursing workforce right the way around the world.
More than 50% of healthcare workforce are nurses, and the care they provide change the life. You are listening to the Global Nursing Leaders Show. Here I will talk with the nursing leaders who are globally known for their leadership skills and care delivered. Today we are going to talk with Howard Catton, who is a well-known nursing leader and Chief Executive Officer of International Council of Nurses. Hello Howard, I'm Raj. Welcome to the Global Nursing Leaders Show by Nursing News India. I would like to ask some questions about nursing in the world. As per the WHO, world is short of 6 million nurses or even more. What is your message to the world to fulfill this demand?
Firstly, Raj, it's a pleasure to talk to you and to talk to Nursing News India as well. You're right. The global shortage of nurses is 6 million. We identified that in a report called The State of the World's Nursing, which was published last year, and ICN co-chaired the production of that report. But that report was produced before the pandemic. So the 6 million figure doesn't take account of the impact the pandemic has had on the nursing workforce right the way around the world. And we also know that in many countries, the nursing population is aging and is due to retire in the next few years. So I actually think that the true scale of the shortage, the numbers of nurses who we need to replace over the next few years, could be in excess of 10 million. That's a huge number. There are 27 million nurses, 28 million nurses around the world. And what the State of the World's Nursing report said very, very clearly, and bear in mind, this is ICN, but it's WHO, it's the Nursing Now campaign as well, was that countries need to massively invest in nursing education. We need to grow our nursing workforce right the way around the world. This isn't nurses for nurses' sake. This is because nurses are central and key to dealing with all of the major health problems that countries in every corner of our world are facing. Infectious disease, of course, is right in front of us at the moment, but non-communicable diseases, aging population, the importance of prevention, public health, end-of-life care, these are all aspects of health and care that we simply can't deliver without nurses. But as well as retention, Raj, the other thing that I'd stress is the importance of retaining the staff that we have. It's hopeless if we're investing in educating more nurses and at the same time we are losing the existing workforce because of overwork, pressure, lack of respect, poor pay, the failure to provide opportunities for career progression. So my message very simply is yes, invest in education, growing the workforce, but do as much to retain the staff that you currently have.
Nurse to patient ratio is critical for the healthcare delivery. What is your thought on this when the present scenario needs more preventive care workforce, such as vaccination?
Yeah, look, you're absolutely right. We now have an overwhelming and powerful evidence base that shows us that the right numbers and the right skills of nurses are directly related to patient outcomes and improved patient outcomes. And conversely, where there are too few nurses, the risk of harm, safety, inadequate care, poor care, patients' dissatisfaction all increase. So I think there's a very strong argument here to say we should be thinking of nurse staffing levels as a patient safety issue, and we should be framing the arguments for investment in nursing as being about the safety of people everywhere. And there are then lots of things that can be done to ensure that you have the right numbers of nurses in the right place at the right time. I mean, in some places that you may look at the total number of nurses and say, yeah, that's great. We've got, enough nurses, but they're in the wrong locations. All of the nurses are in hospitals, and there are shortages in community facilities, in general practice, in non-hospital settings. You might look at the numbers and say, yeah, it's great, we've got enough numbers. But then when you dig down, you find that there are lots of more junior staff who are lacking expertise, support and mentorship. The role of nurse managers, ward managers, or experienced district, community, public health nurses are crucial, not just for the nursing expertise that they bring to care, but also to support, to develop, to teach, to educate future generations. So we need to look at not just the numbers, but the skills and also the location. The pandemic is putting a massive strain on nurses right the way around the world. We are seeing that ratios are being stretched, particularly in intensive care units where 1-to-1 nurse-to-patient ratios are being pushed to 2, 3, even 4. I've heard as well. These are extraordinary circumstances and times, and we must do all that we can to make sure that people get the care that they need. But we shouldn't lose sight of the question: how did we get into this situation? And the reason we got into this situation was a failure to invest in nursing, a failure to educate enough nurses. And we are having to deal with the consequences and the very difficult and challenging consequences of that right now. And that's why I say that a legacy of COVID should be that we invest much, much more strongly in our nursing workforce.
ICN is promoting a thought of investment in nursing. What kind of investment we are talking about, and how it will change the future of nursing?
So I think there's a couple of things for me, Raj, about this. The first is that we have struggled to get investment in nursing. People have seen it as a cost. Politicians have just seen it as an expense that they have to pay without recognizing the investment. And everything that I've said about the improvement to patient outcomes, the response to coronavirus, this is demonstrating to people right the way around the world that money investment into nursing, into health services is exactly that. It is an investment. It's a cost. It's an investment that not only buys us healthcare, but buys us the ability to meet friends and families, to take a walk in the park, all of those social freedoms that we so dearly cherish. So we need to do something to change the mindset of the money that we spend, that we invest in healthcare. The other thought that we had at ICN is that if you look what's happening around the world, there are some sectors of economies who are suffering hugely as a result of coronavirus. Travel, hospitality, in particular, retail industries as sectors as well. And many people who have or will lose their jobs. At the same time that we have people losing jobs and unemployment problems in some parts of our economies, in other parts of our economy, in healthcare, we have these huge shortages, the 6-10 million that I've talked about in nursing. So why aren't we joining the dots? Why aren't we thinking about how we support people who are losing jobs in some sectors to consider retraining, being educated to move into healthcare? I'm not talking about dumbing down standards or lowering the entry gate, but I think that there are many people who with the right support, would be interested in moving into healthcare. But that takes money. If you're going to retrain the education for that, having the teachers, the colleges or the universities to support people during that training as well, with perhaps living expenses, there's money that's required. So we've said, why don't governments think about setting up health education retraining opportunity funds? We suggested you shorten it to a hero fund. It's just an idea, but we think that it's also important that nurses and the nursing profession participate in these big economic debates that our countries are having, for all the reasons that I've said about investing in health and the benefit that brings, but also this idea of how we could help more people to move, practical idea through hero funds to help people to move into healthcare as well. Nurses often shy away from the policy debates or the political debates as well. I'm not talking about taking political sides. I'm just talking about getting involved in the debate. And I think nurses have a legitimate, powerful and really important voice to help shape our future societies and the world that will come after COVID.
Aging nursing population and retaining the nurses are the latest concern all over the world. What are your suggestions in this direction?
So we just recently, at the end of last year, produced a report on older nurses. Professor James Buchan, a world-renowned nursing workforce expert, worked with me and ICN to produce that report. It's on our website with a lot of other ICN reports and materials. So encourage people to look at that. That report highlights the potential scale of the aging nursing population. It's not the nursing population isn't aging in all countries. It's more of an issue for countries in Europe and in North America as well. But it's very significant. A quarter to a third of their nursing workforce who will become eligible to retire over the next few years. And as I've said, the last thing we want to do is to be losing the current workforce at this time. We should think of them as gold dust. So it raises the question, are we doing all that we can to support, to protect, to retain the current nursing workforce? Our report sets out a 10-point plan of the things that we think need to be done. I won't go through all of them, but I'm sure your listeners will be able to immediately tell you the sorts of things that are so important in terms of decent working conditions, being respected and listened to at work, having the opportunity for career development, help with flexible working if you've got either young family or elderly dependents as well. These are the sorts of things nurses tell us are crucial to holding them in the workforce. And the other thing I think that, well, I know that comes through very strongly, and sometimes we don't talk enough about, is that actually the issue that a couple of issues that nurses raise with me in terms of their frustrations with their jobs and with their work. Staffing levels is a big one. We've talked about that. But the other one is people who say, I just don't feel that I can give the care that I've been educated to. I came into this profession to do the best that I could for patients, and daily it can feel like an uphill struggle to deliver the care that I've been educated to the standard that I want to as well. And I think that if all organizations providing healthcare think about that and have that conversation with their nursing staff as well, what can we do to make sure that we provide people with the support to deliver the best possible care? That, I'm sure, will also help to retain nurses in the workforce. It's important that people who run health facilities engage staff in that way, treat them as equals and as partners, listen to their to their voices. And at the end of the day, surely it's a shared objective. Anybody who's involved in healthcare wants to provide the best that they possibly can for the people that they serve.
No pressure, no progress is your statement for the role of nursing associations around the world. Could you please shed some light on this?
Well, look, I've had the very great honour of working as a nurse or on behalf of nursing in a number of countries around the world, advocating, campaigning, talking to policymakers, talking to politicians as well. And my experience is that people don't move or don't change unless you present a really convincing argument for that. That's about, yes, it's about evidence, it's about data, it's about the experiences of frontline staff, it's about the consequences of not changing and leaving things as they are, but it's also about showing hope and vision and what a better future for us all can be. But that sort of advocacy, that total advocacy and campaigning, using all of those elements that I've talked about as well, the reality is it will at times make our leaders feel uncomfortable because it will highlight where there are weaknesses and flaws in the ways that we're currently doing things, where some decisions have not been the best for healthcare or for our nursing or healthcare workforce, even where decisions that people you talk to may have themselves have taken, and you're asking them to undo those and to make other decisions. That's the reality of how change comes and how people who have political policy power make those decisions to change. I had the very great pleasure just before Christmas, Raj, of talking to a congresswoman called Lauren Underwood, who's recently been re-elected to the U.S. Senate in America. A young woman, she's in her 30s, a formidable nurse and politician. Again, you can see those interviews on our website. But she talked about nursing having a responsibility to engage in the political and the policy process. Again, not in a partisan way, but getting involved in the debate. And she talked as well about the reasons nurses might shy away from that. Sometimes we think it's a dirty business. Sometimes, we're in some cultures, it might be that, if you're a woman, and of course our profession, 90% are women, would leave those decisions to the men. Some people are disillusioned by it as well. But Congresswoman Underwood talked so powerfully about her experience and how actually her nursing gave her answers and solutions to some of these big policy questions in debate. So, yes, I say get involved. Yes, the reality is that it will require and involve applying some pressure, because it's only through that pressure that you build momentum and deliver change. But nurses, be absolutely confident that you have many of the solutions. Your insights, your experience, your views are hugely, hugely valuable. I have said I don't know how you can possibly make good health policy without having nursing contribution to the debate.
Nurses play a vital role in the healthcare data collection and analysis. ICN's collaboration with SNOMED Development makes international classification for nursing practice globally adoptable. How you envision the progress in this area?
So the ICMP program, the nursing language work that ICN has done for a number of years now, I think it showed great foresight by previous leaders of ICN to establish that project to develop nursing terminology and language. Too often, this invisibility that we see to nursing contributions, and I see it around COVID now in some countries where, if you listened and watched the news, you just see scientists and you see doctors, and you wouldn't believe that there are thousands of millions of nurses who are actually delivering frontline care. Yes, there are all the things we've talked about getting involved in the policy, in the political process, but you also need the data to demonstrate, to show what it is that nursing is doing. And the ICMP language has been fundamental in terms of giving us tools and framework to identify that nursing contribution to all areas of health care. We have in the last 12 months gone into this strategic partnership with SNOMED. SNOMED, globally recognized language provider, and we're really delighted to have the partnership with them, because I think it will help not just embed nursing language, but also roll it out to many other countries as well. What do I hear? What do we hear people say now about data? It's the new oil. Perhaps that's not a very climate change or green phrase to say, but it does give you that sense, I think, of how important data is becoming to our economies, to our societies, to our world as well. And as I say, this is an initiative which I think is very important to help nursing determine and bring forward the language that helps to define and describe what our contribution is to healthcare.
Nurse practitioners are contributing more than balancing the load during public health crisis. At the same time, shortages of physicians and their engagement in more crucial things is a biggest concern in the care delivery. A recent development in USA for the independent practice of nurse practitioner, even without physician supervision, is an indication of nursing empowerment. Do you think this can be a game changer in the industry if adopted globally?
I do, Raj, and I think it's happening already. You mentioned the recent developments in the US. Just in the last few hours, I retweeted a story about what's happening with nurse practitioners in the US, where they're relaxing the restrictions on independent practice for nurse practitioners. ICN last year produced a report on advanced nursing practice. Again, it's available on our website. This, for me, is another example where nursing has a solution, another solution right under our noses for meeting future healthcare needs. Everybody is concerned that our health systems are overwhelmed, taken up with caring for COVID patients, but of course, there are millions of people around the world who are still getting sick with all other sorts of conditions, from heart attacks to strokes to cancers as well. And how do we continue to meet those health needs at the same time as dealing with COVID? And if you think forward to the future, it's non-communicable diseases which are going to, dominate the work of our health systems right the way around the world. But when you then break down the sorts of care and support those people need in terms of how they manage their condition, the health prevention, public health advice that they need, we see around the world examples of nurses working in advanced and specialist nursing roles, where they may be providing first contact care, where they may be providing long-term care for people with chronic conditions, where they're providing end-of-life care, where they're providing public health and preventative health care as well. They are meeting not only the needs of today, but increasingly what the healthcare needs of tomorrow are going to be. And the evidence again shows us that they're doing it in an effective and safe way. The outcomes are worse than provided by our medical colleagues. Often nurses are much closer to people, and particularly in remote and rural communities, it's the nurse who's the healthcare professional you're most likeliest to see. Patients like it. People like the care. They always consistently rate highly the care that they receive from nurses as well. And I think there are some economic benefits. Some of these models of care, nurse-led care, are I don't want to say cheaper. They're more cost effective. But countries around the world are facing economic pressures and are going to even do so even more as a result of COVID. So we have, and we shouldn't be embarrassed about talking not just about how nursing care and nursing models and nursing roles are care effective, but we shouldn't be embarrassed to say they're also cost effective as well. Again, you're starting to present really powerful solutions to politicians and policy makers. So I do think that advanced nursing practice is already proving to be a game changer. We need to get behind it and push it harder and roll it out in many, many more countries. And where it exists, because it does exist in many countries, I think it's then a question about liberating it, take away the barriers and the restrictions that are often put in place.
You are a good communicator and active on social media. Some of your video messages look like a film actor is communicating a message and leave a great influence on the listeners. There is no doubt that people get inspired by films and movies. Did you anytime thought about playing a role in a movie where nurses represented and people get motivated?
Yeah, so that's a question that I've never been asked before. That's a first. Look, I do think that communication is really important. I think nurses are excellent at it. I think it's one of our fundamental skill sets. I think that often we all hear people who make language complicated and confused and difficult, and I think it's important to try not to do that, to talk plainly, to talk in common sense and straightforward ways so that people can understand what you're saying. It's only if they understand that you're saying that they will have a debate, a discussion with you, that you can have an argument, and they might disagree or they might agree and they might do what you want them to what you want them to do. As far as the movies are concerned, Raj. So listen, I'll let you into a secret. Well, not so much a secret, but some personal information. I have a very special place in my heart for India, because when I got married, my wife and we got married and we jumped on a plane and we spent our honeymoon in India. I had 3 wonderful weeks traveling around Rajasthan, then over into Goa. We managed to come back a few years later to southern India as well. And I just love the vibrancy, the energy, the culture, the people, the foods, the whole Indian experience. And part of that Indian experience on my honeymoon was that we went to see a Bollywood movie, which was a movie, it was a going to a cinema experience like the likes of which I've never had before. And that was it was wonderful. And I do know that some Bollywood movies have included portrayals of nurses. I know that sometimes the nurse might be the love interest. I know sometimes it shows the nurse's care and compassion, which is really important. But what about if there was a nursing role in a Bollywood movie which showed all the things we've talked about, the leadership, the complexity, the reality of modern day nursing, strip away some of the stereotypes, perhaps as well as having a woman have a man as well who was in nursing as well. So there you go. That's an answer to a question that I've never been asked and haven't had to prepare before. But Yeah, genuinely, Raj, I think that wouldn't that be wonderful if there were more portrayals of nurses like that within Bollywood. Many media outlets who recognise the reality, who want to move away from the myths and the traditions as well. I mean, this has been the year of last year was the year of the nurse and the midwife, and it wasn't a year that any of us had planned or expected to have. But one of the ambitions of that year was to profile nursing and the reality of modern nursing in a way that we've never done before. And it's with irony, it's with some sadness as well, because of the losses that we've suffered and the sacrifices that nurses have made. But the nursing response to COVID, I do think, has fundamentally shifted and changed a lot of attitudes and perceptions about nursing. We need to build on that. We need to now follow that through to make sure that, where hearts and minds have been changed, policy decisions, investment, actions, all the sorts of things that we've talked about, they also follow from those changes to mindsets.
Nurses from India and many other countries are migrating to UK, US, Australia and Middle East to help at the time of pandemic and future need. How do you see this scenario?
So the migration and mobility of nurses around the world is a hugely important and significant issue. We last year produced a report on migration and mobility of nurses around the world, and people who are interested, do look at the website for that report. I think the first thing to say is that there are countries, and India is one of them, the Philippines is another, who have been enormously important to the world in the supply of nurses, and whose nurses are highly respected and have contributed enormously to healthcare systems in other countries. And nobody is going to stand in the way of the right of people to move, to migrate, to have other experiences. That can bring a lot of learning, both for the person who's migrating, but also where they're going to. But as we said right at the start of this discussion, there is a global shortage of nursing. And the bottom line is that all countries, in my view, should do much more to become self-sufficient in the supply of their own nursing workforce. When I was in the UK more than 10 years ago, and the UK was recruiting from some sub-Saharan African countries, the impact of those countries losing perhaps even just a few nurses who moved, was that the healthcare systems in those countries that lost their nurses could be severely impaired, even unable, having to stop providing services. So there are some really fundamental ethical issues and considerations as well. I know, obviously, India has a huge population. You've got a political commitment to universal health care. Is it Modi's law? I think that's great that there's that commitment, but how is that going to be delivered? Nurses are going to be absolutely fundamental. So what we must make sure is that when people move and migrate, that doesn't exacerbate shortages in some countries. It doesn't lead to people in some parts of the world getting less access to healthcare because their nurses are being recruited to other countries. We're not robbing Peter to pay Paul. This is an issue of huge interest and attention to the global community. WHO discussed it at their meeting last year. They're going to be discussing it at their meetings again this year as well. We are a true global profession, and as I say, there's some real benefits when people do move around the world, and that's their right as well. But we shouldn't we shouldn't use migration mobility as short-term measures, quick fixes to address the long-term underinvestment in nursing education that we've seen in far too many countries.
Thank you very much for your time and sharing ideas and thoughts for the nursing communities.